Meet me in the middle.
Hi, and welcome to Meet Me in the Middle. I am Kirsten Cole. I'm your host. We are here because we want to talk about all things in midlife. We know that our best years are not in the rearview mirror. They are being built. They're in front of us. We like to talk about health, relationships, and money. And today I am so excited to bring in our guests because we're talking about how to be ageless, right? We all have so much that we want to achieve and do, and all the people that we want to be with for the rest of our lives. So to bring us through all of this is Dr. Michael Aziz. Thanks so much for being with us today.
Thanks so much for having me.
We're so excited to dig into this topic because I love to dabble in all of these things, but I want to get a deeper look. You are a board certified internist. You are an author. The Ageless Revolution is one of your books, and you're also a speaker, you're a practicing doctor. Let's talk about what it takes to be ageless. And first of all, I wanted to say, what is an actual definition of ageless? Like never die, or what are we trying to do?
Well, there's a difference between biological age and chronological age.
Right.
Chronological age is the date that we are born. Biological age now is a new concept in medicine, and it's more important. It's the age of our cells.
Right.
So the point is to be healthy for a very long time.
Yes.
And to have not only a longer lifespan, but
Right.
to have a healthier lifespan with no disease.
I
And
love
that's my
that.
definition of becoming ageless.
Yes, health span, because we want to live, but we don't want to live poorly. We don't want to live where we can't do the things that we want to achieve. So when we talk about you as a regenerative medicine specialist, an anti-aging specialist, what are some of the pillars of what you do with your patients and with your readers and the people that you speak to when you're speaking and addressing people? What are the pillars of what we must do to create our foundation for ageless living?
Well, I was retrained as a traditional doctor, and then I retrained in functional medicine because the way medicine right now is practiced is so old-fashioned. It's really about sick care, and I want to change this concept to become about health care. It's about
Yes.
preventing disease from happening in the first place. It's not about living longer with all the big things that kill us: heart disease, cancer, stroke, and
Diabetes,
all that
metabolic
stuff. So the point is
disease.
to live a long life
Uh-huh.
and to be healthy in the same time.
Right.
And I had to retrain, and we have to change everything we learned because our guidelines from the government are wrong.
Ugh.
The guidelines from the medical establishment are wrong. The seed oils, the fake oils.
Ugh,
I
terrible.
grew up on margarine, trans fats, eating that stuff, thinking it's good for me because they told us it's good for us. So I had to change everything we think is right, which could be wrong. So it's our diet, it's our exercise, how often do we eat? It's not about eating every 3 hours, it's about skipping a meal once in a while. And then all the advances in medicine that can make us ageless, from supplements to medication to peptide and so on. And that was my goal in writing this book.
And I really appreciate that you're able to get it into one edition. And then you're also able to preach it and live it with your patients. And I know that for some of us, right, we live a lot of this universe in this space and we're already doing these things. For others, you may just be hearing about these things for the first time. Peptide, what? And intermittent fasting, what? But these are all things that we can do, and maybe you sort of tackle a couple of them at a time. Me, in my life, I think the most important thing that I can do, because I'm a mom and I'm in charge of feeding my little guy, is food. For me, that's sort of the number one thing that I really want to be able to control. And I can do that by shopping and cooking for myself. This may be really novel in a time of like Instacart and, Uber Eats, but I need to cook for myself. What should we be aiming to do with our food consumption, and what will that get us in our pursuit of being ageless?
So I've been on TV a few times, and I talked about the amount of processed food that we're eating is just tremendous. We're eating tremendous amount of processed food, and that's linked to heart disease, is linked to cancer, and that's bad. I also wrote in my first book, The Perfect 10 Diet. It's a clean diet that balances hormone, that we're on the wrong track when it comes to low-fat diets, low-carb, keto, which are now very much in vogue. You don't want to eat just not sugar, but you want to avoid all the chemicals, the nitrites that are linked to cancer, cancer in processed meat, in bacon, sausage, and all the people, all the viewers who are on keto diet and they're losing weight and they judge their success just by how many pounds they lost versus if they're really getting healthy on the inside.
Right.
So I think we have to start with diet and nutrition. We have to avoid chemicals, artificial sweeteners, nitrites, the fake fats, the seed oils that are promoted even by the medical establishment, the vegetable oil. They're not good for us.
There are no vegetables in vegetable oil, Dr. Aziz. That was like the best. I would love to have been in the conference room where they came up with that name. They were like, what should we call this? And they're like, vegetable oil. People will think they're eating vegetables.
Well, I'm glad people like you are bringing the public to the attention now of the danger of seed oils. There's a lot of talk in the news about seed oils.
Where do we find seed oils generally?
It's any
besides everywhere.
It's corn, it's soybean, it's cottonseed. Cotton is not supposed to be for human consumption. It's from my shirt. And they go through 1,000 chemical reaction. They create free radicals.
To strip out the oil.
And unfortunately, many of those guidelines that were promoted to doctors that avoid the saturated fat, the butter and cheese and all that stuff came from the soybean lobby. And as a result, we're eating a lot of fake food and thinking we're doing the right thing, but we are not. So people have to start with their nutrition.
So I say, a lot of times seed oil, it's like pretty much anything that's found in a bag or a box. If you're buying food from a bag or a box, chances are it's got a seed oil. And you do need to, if you are going to buy those types of foods, you got to flip it over and you have to read the label. And then you have to make decisions. How much of this do I want to put in my body? How much of this do I want? And how much of a risk do I want to take? When it comes to how inflammatory they are,
absolutely,
and leading to cancerous, situations where it's ripe for cancer.
Yeah, I mean, I was on TV. I think I was on The View 16 years ago, and I was one of the first doctors to talk about eating butter. And I went against the guidelines. I went against Harvard.
You and Paula Deen, more butter, more better.
I like Paula Deen. We were told in medical school and residency, the French paradox, they eat butter, but we don't know why they live so long. Well, because butter doesn't cause any problem.
They weren't eating the disaster ingredients.
So people have to stay away from all the processed food, the fake oils. They have to start with their nutrition, their diet. Before they move on to the next steps in becoming ageless and becoming healthy by doing the right exercise, the right supplements, the right medication, even moving to peptides.
And so we're going to hold off on speaking about peptides, which is one of my favorite hot new topics. We're going to make you watch so that you can get to the peptide part, because this is just such an exciting part of medicine right now. You are an advocate for intermittent fasting, and you teased that a little bit by saying, don't eat every 3 hours, and maybe it's okay to be a little hungry or skip a meal. Talk about why that's so important and introduce this concept of autophagy.
Yes.
Yeah.
So, many of the guidelines were really low-fat diets, for example, came from politicians. It did not come from any science. And before you know it, you have every doctor tell you if you have high cholesterol to follow a low-fat diet, and people are eating, processed food and cereal instead of eggs. So the idea of eating every 3 hours also came from bodybuilders who want to build a lot of muscles, who want to consume 5,000 calories a day.
And they told us, protein,
eat 5 times a day. Don't skip a meal. But we were not built as humans. We were not built to eat every 3 hours. In fact, sometimes like animals, we starve for days until our next meal. So intermittent fasting is very, very good for us. It's linked to longevity. It has been proven in many species, because what happens, Kristen, is when you skip a meal, I'm not talking about starving yourself for days, but I'm talking like skipping a meal once in a while, as long as you're drinking water and you're not dehydrated. The body is like, what's happening? Is that person going to go in starvation? So the body starts to eat not only the fat, and you start burning fat, but it starts also to eat the dead cells, the cancer cells. So in the Middle East, for example,
they have misshapen, the malfunctioning
cells. They call them the zombie cells. So this is one of the hallmarks I talk about in my book. It's one of the hallmarks why we age. Those senescent cells, the old cells in our bodies, don't die. Not only they don't die, but they sit around and they disrupt the young cells. You want to get rid of that. them. And the easiest way to get rid of them is to skip a meal once in a while. So in the Middle East, they have this months where they don't eat Ramadan.
Right.
And they eat tons of sugar. They eat from 8 o'clock at night all the way till dawn. But the rates of cancer in the Middle East is 85% lower than the United States and Europe. And that's one of the benefits of intermittent fasting. So for our viewers, I think it's a great idea on the weekend not to have breakfast, maybe have a black tea in the morning and then just go for brunch at 1 o'clock. It's easy. You could do it. And it's just, you're getting rid of the senescent cells, the zombie cells.
And you feel so virtuous when you do it. You're like, oh, I can't, I'm fasting, and then you could put the fancy name on it. Oh, I need to I need to go
for a
into
nice brunch after that.
Yes. And then you can go into brunch after that. Supplements, where are you on that? I'm somebody that I take supplements. I truly believe that we don't get enough nutrients from our food because our soils have been depleted in the way that we farm. And so I do want to supplement, but sometimes you can spend a lot of money on a lot of fancy supplements, especially if you don't have somebody sort of helping guide you through that, which I think a lot of us are in this place where we get some guidance and then we get some Instagram. And so where do you fall on supplementation?
So, in my book, I talk about the blue zones, the 5 areas in the world where people live to 100 and they don't take any supplements. But we live in New York, we live in the United States where our diet is not optimal, our nutrition, we're eating processed food. So I think supplements fill that void, but you have to get the right supplements that the research shows it can promote health and longevity. Many of us, for example, don't take fish oil, but fish oil is linked to 4 years of longevity. So if you're in an area of the country where you don't have access to a lot of seafood or you're not eating a lot of seafood 2-3 times a week, fish oil would be a good addition. If you also
it's great for brain health.
Yes, absolutely. Right? And it prevents heart disease, it prevents cancer. And also, if you live in an area that there's not a lot of sun, if you live in New York or Chicago.
Those vitamin D levels go dipping.
Vitamin D is very important also to prevent cancer. And it was the number one reason why we have such high rate of mortality and morbidity from COVID-19, because all of us were deficient in vitamin D. So I talk in my book about the supplements that are linked to longevity. There are supplements that also help with autophagy for our viewers. Some of them cannot skip a meal. There are supplements that
I admit I am weak.
Yeah,
it's
so
hard.
You can take fisetin. Fisetin is a good supplement to get rid of the senescent cells.
Okay.
Quercetin is a very nice supplement to get rid also of the senescent cells. Taurine is a very good supplement.
And what about just a good overall multivitamin, multi-mineral to sort of fill in some of the gaps for us?
Sure. If you're not eating a lot of vegetables, just make sure it's a whole food pill versus a synthetic vitamin, because synthetic vitamin E is also linked to stroke. So you don't want to take a synthetic vitamin. You want to take a natural pill.
Okay. All right. This is a very good primer. When we come back, we're going to talk more about sleep. We're going to talk about exercise, and then we're going to talk about the super sizzly topic, peptides. And yes, those are in your GLP-1s, but it goes far beyond that. And we're about to see a lot of explosive information and growth in the peptide market. I'm Kirsten Cole, and we're going to unpack those topics on the flip side here when we come back to Meet Me in the Middle.
You're watching Meet Me in the Middle.
Welcome back to Meet Me in the Middle. I am Kirsten Cole, and we are here with Dr. Aziz so we can figure out how to be ageless and increase not only our lifespan, but our health span, because we want to be ageless, but we also want to do it while we're living healthy. So much has been happening in the space of hormones, and I've been so excited to do several episodes on that when it comes to women. We haven't talked so much about men and their hormones as well. We hear so much from women because we're supplementing with estrogen and progesterone and testosterone. And so bring in the men too and talk about when and how they need to be supplementing.
So one of the hallmark of aging, Kristen, also the cells have to talk and to each other. And that's when we need hormones. Hormones is what makes the cells talk to one another. So in menopause, the sex hormones in women, estrogen, progesterone drop all of a sudden. In men, testosterone declines gradually, and it starts to decline from age 25. And in fact, we have an epidemic in this country.
Oh, you're making our men so sad.
Yeah, we have an
declining at
epidemic of
25.
low testosterone in men. And as testosterone goes down, many doctors do not treat. They treat the symptom. They may treat the men for ED. They may give them some Viagra, Cialis. He may gain some weight. He say, cut your calories. But
Right, you
really
got
the
the dad
problem is
bod going, yeah.
the problem is a declining testosterone, and has to do also that we're eating a lot of processed food. We don't have enough seafood with zinc. We don't have enough vitamin D. Stress is very bad for testosterone. And as testosterone goes down, also the risk for disease develop as well. And that's an issue.
So I know that a lot of women are using male testosterone gel in order to supplement their testosterone. Are men using testosterone gel? I'm assuming they are. And who's having these discussions with men?
Again, like I told you, many doctors are not experienced or have been trained in treating those minor hormones. So we treat diabetes, we treat thyroid, but many doctors are not trained to deal with minor hormones.
I don't think my husband's ever had a testosterone level test.
And believe it or not,
should they be having it every year?
Well, at least he has to be checked if he has symptoms. But believe it or not, even for women, there is not a single drug on the market, testosterone for women, you can buy from the pharmacy. You have to get it from a compounded, as if like the drug companies don't believe that women should supplement with testosterone.
Right,
which
that's
is
okay. We're knocking on their door and we're screaming outside.
Yes,
so we're trying to get everybody's
you
attention.
did that with the bioidentical hormones. So so that's an issue for both men and women, that the drug companies even don't have those products for women.
Why aren't we testing men for testosterone? If they're starting to wane at 25, why does it have to be symptomatically driven? Why can't we just be optimizing man's testosterone?
Again, doctors were not trained to treat aging as a disease. I mean, I talk in my book how my mom, when she was in her 50s and she was having all kinds of menopausal symptoms, hot flashes and night sweat, the doctor would just say it's part of getting old.
That's right. Suck it up, buttercup.
Correct.
Here's some biting bullets for
and
you.
Then the problem is that the doctor also may tell you your hormones are normal for your age. So you don't want to be compared to someone your age group. You want to be compared to the younger person you could be.
And also, I want to optimize. I don't want to just be normal. I want to be fabulous. And if there's a way to do that, help me do it. So men would need to see an endocrinologist then to get on this testosterone track, or a progressive internist who understands this?
It has to be someone who is progressive, who does functional medicine, who understand that a normal testosterone for a man is about 800. So if you are a 25-year-old with a testosterone of 300, that's a low level.
Right.
And that you can have a lot of symptoms and they can be missed, because also he may compare you to the lab reference versus your age group.
Right.
So you don't want to be compared to an 80-year-old man. You want to be compared to somebody who's your age, 25, who should be at 800 or even above.
Okay. All right. We have our prescription pad. We need to go and find our appropriate physicians. We want to take another break here. And when we come back, we are going to talk about peptides. I am so excited about this. You've heard about peptides with GLP-1s, right? We've got the injectables. Now we've got the pills available. There is a whole other world when it comes to peptides. And we're going to unpack it on the flip side when we come back from this break on Meet Me in the Middle.
You're watching Meet Me in the Middle.
Hi, I'm Kirsten Cole. I'm your host. This is Meet Me in the Middle. We are here today with Dr. Michael Aziz, our board-certified internist, but also our specialist in functional and regenerative medicine. And we are unpacking all things on a roadmap on how to be ageless. So we have talked about our diet. We've talked about supplementation. We've talked about cell autophagy and hormones. Let's talk about peptides now. First of all, are peptides brand new?
No, the research on peptides goes about 100 years, but it really started in Russia about 50 years ago. So the research was done in Russian. And that's why, unfortunately, most doctors in the United States don't know about peptides. And the revolution is happening from young people. You go on Instagram, you find them talking about different peptides. And that's where really it's happening. And a lot of peptides can help us stay living longer and become ageless.
Right.
And we have to use them to fight the aging process.
And I know that you advocate for that in your practice, correct?
Yes, I'm very big on peptides. It's one of the weapons to fight aging and to fight disease, because aging is a disease. And that's just one way. So we have to fight aging with a diet, with stress management, eating correctly, hormone replacement, and peptides fit also the bill.
What types of peptides are you talking about? We know about GLP-1s.
Yes.
Tell me about some of these others and what they do.
So, most of our viewers know the GLP peptides, but if you see the commercials on TV about the semaglutide and the tirzepatide, not only they lead to weight loss, but they also prevent heart attack and stroke. Anything that drops sugar can lead to longevity. I think the problem is many people are doing the wrong thing. They may eat still processed food. They still may eat pizza, and using the GLP, they're losing weight.
Don't attack our pizza, Dr. Aziz. This is New York, baby.
Yes, it's true. But if peptides, the GLP, are done correctly, there are longevity peptides at microdose. So many, so they can prevent heart attack and stroke by 22%. At a tiny dose, as long as you don't lose your muscle mass, as long as you're eating enough protein when you're on a GLP peptide. And it's very important for our viewers to also do strength training at least 3 times a week if they're taking GLP peptide. But
it's very important no matter what,
yes,
especially
absolutely.
as a woman.
As we get older.
Yes, right here. I mean, I'm a slight Caucasian woman, and I am at risk for osteoporosis. I need to throw around them heavy kettlebells.
Yes.
And we all do.
Yeah.
What are some of the other peptides that you're talking about? What are their names? What do they do?
So, there are some peptides that are not FDA approved, but they are used in Europe and they're used in Russia. So there's one peptide that is used in Russia called epetalon. One of the hallmark of aging, Kristen, is as we get older, when the cells divide, the telomeres, the end cap of the chromosomes, get shorter. So think of the chromosome as a shoelace, and then as the cells divide, the telomeres get shorter and shorter, and eventually there is no more cell division and we die. So you want to keep the telomeres longer. And one way to keep the telomeres longer is having fish oil that we just talked about.
Great.
4 years of longevity.
Okay.
Vitamin D.
Okay.
Very
check.
important if you live in an area that doesn't have a lot of sun. Stress management, because stress is very bad for us.
Right.
And one peptide that is used in Russia that is linked to longevity is called epetalon. It's not FDA approved, but it does lengthen the telomere. So it's another peptide in our arsenal to fight aging.
And I know that this is something that you advocate for. How do you get these peptides? Where do they come from?
Many peptides are FDA approved. You get them from the pharmacy, from your regular local pharmacy. And some of the peptides that are not FDA approved, we try to get them from a lab that is inspected, that is registered, to make sure you're getting the right peptide. Because unfortunately, right now, many people are getting their peptides on the internet. You don't know if you're getting the wrong thing, the wrong dose. Maybe it's not clean. Maybe you're not getting anything at all. So you have to do it also under the guidance of a doctor who's trained in functional medicine and who knows about the peptides.
Okay. And so what are the other peptides? I know you were talking to me
There's
about
300,000 peptides.
No, but I want to talk about the popular ones. You were talking to me about anti-wrinkle peptides.
Yes. So there are peptides.
I'm listening.
So there is a peptide called GHK copper, and it does fight the wrinkles, and it makes new collagen. So that's also, as we get older, not only we lose muscle mass, but we also lose our collagen production.
I know.
So you want to optimize that. That's another peptide that you could use as a cream for your face.
Okay.
Or you could do it as an injection.
Okay.
That's not an FDA-approved peptide, though.
All right.
And sometimes, they combine it with different peptides. That's called stacking peptides.
I've seen that.
To optimize the levels.
Right.
To optimize the results. So sometimes they combine it with another peptide called BPC157.
I see a lot about BPC157. What does it do, and where do I get it?
So BPC is another peptide. It's not FDA approved. In fact, it is banned. The reason it's banned is because of the doping, because they don't want the athletes to win. Just like testosterone is banned in athletes. They don't want to win.
We know that things can be abused, right?
Yes.
So how does one, when should one take BPC 157? And then, how do you take it, and how do you do this? How do you navigate this space if there's the potential for abuse?
Yeah. So BPC is a peptide that is, naturally produced in our stomach. It has the ability to heal the tissues. It can help with a gastric ulcer. It can help with inflammatory bowel disease, Crohn's disease, ulcerative colitis, and it also helps with joint recovery after injury, after surgery. If you're going to do it after an injury or after a sport injury, you want to do the injection versus the oral form. And at a smaller dose, they combine it with a GHK, and it comes with in a form of a peptide called Glow or Clo. That's the peptide for the skin.
And then besides going to you directly, how does one find these physicians that are able to guide you through a peptide journey?
I think you have to do your research, because unfortunately I had to retrain in everything. I had to retrain in diet and nutrition. I had to retrain in hormone replacement. I had to retrain in peptides. I had to learn about all those peptides. It's almost I went to medical school again, because I was not happy with the way medicine is practiced. Again, the sick care. There's a new way to age, and that's why I feel patients are leading the revolution now by knowing about intermittent fasting, about the supplements, about peptides, and hopefully we can all go in the right direction.
The consumers are really driving the conversation, and what I find so stunning about this is, since I have spent a little bit more time on planet Earth, is that previously medicine moved very slowly, and watching this hormone revolution with women, it has really just pushed the envelope and just so much quicker. And it's either you're with us or you're going to get left behind. And so if you want to be with us in this revolution, help us do the studies. Let's do good science and good medicine, but we need to move on this. And the time is done for suffering and staying behind. And now is the time for maximizing our lives and having a better health span. And I so appreciate that you're advocating for it. The Ageless Revolution, Dr. Michael Aziz, you've been my terrific guest today. We could have 50 more episodes with you. I so appreciate your time, and I so appreciate your time here. So make sure you keep giving me the feedback. Drop the comments down below. Let me know what you want to hear about. I'm on the socials. Slide into my DMs. Everybody else is doing it. And we want to meet you the next time on Meet Me in the Middle.